Okay, now coming towards fat necrosis. So, in fat necrosis is seen in enzymatic acute pancreatitis in which saponification of peripancreatic fat occur, and in the non-enzymatic, fat necrosis occurs in case of traumatic, for example, injury to breast tissue, etc. Now, the reasons are damaged pancreatic cells release lipase, which breaks down triglycerides, and liberated fatty acids bind calcium. Saponification occur, which leads to white appearance. Chalky white appearance. Okay. How fat necrosis occur? It occurs when damage to pancreatic cells release lipase, and it breaks down triglycerides, and liberated fatty acids bind calcium. Okay, now what is the histology of the fat necrosis? So it is outlined by the dead fat cells without peripheral nuclei, and saponification of the fat occur, which is combined with calcium, and it appears dark blue on H and E stain. Now fibrinoid necrosis. It is seen in immune vascular reaction, for example, polyarteritis nodosa, and non-immune vascular reactions, for example, hypertensive emergency and preeclampsia. Now, it is due to the immune complex deposition, type 3 hypersensitive reaction, and plasma protein, for example, fibrin leakage from damaged vessels. The histology is that the vessel walls contain eosinophilic layer of the proteinaceous material. Now, gangrenous necrosis. It occurs in the distal extremity and GI tract after chronic ischemia, and the cause is dry ischemia and wet superinfection. The histology is coagulative and liquefactive superimposed on coagulative. So these are the types of the necrosis, which are coagulative, liquefactive, caseous, fat, fibrinoid, and gangrenous. Okay, this is coagulative necrosis, and it is seen in ischemia or infarcts. This is the liquefactive necrosis, which is seen in the bacterial abscesses and CNS infarcts. This is brain, which is part of CNS. So CNS infarcts. Then caseous necrosis, which occurs in TB and systemic fungi. Then this is the fat necrosis, and it is histology is that it is outlined by dead fat cells. Then fibrinoid necrosis, it occurs in immune vascular reactions, and this is gangrenous necrosis, which occurs in the distal extremity and GI tract. These are the distal extremities, the hands and the fingers. So the necrosis that occur here is the gangrenous necrosis. Okay, gangrenous, and in the abscesses, which the necrosis that occurs is liquefactive, and in the tuberculosis it is caseous, and in the this is a coagulative, and this one is the fibrinoid necrosis. You should identify the necrosis from the picture. You should have the gross idea that what type of necrosis is it. Now in the next video we will discuss ischemia, and what we will discuss in the ischemia, that what is ischemia, and then what are the types of infarcts, which is red infarct, perinfarct, and free radical injury, and then ionization, radiation toxicity, and types of calcification, and amyloidosis, and then we will wind up our cell injury topic and will start inflammation. So in the cell injury we will be discussing ischemia and the types of infarcts and the types of calcification and amyloidosis in the next video. Thanks for